My name is Sarah.
I'm Brenna.
And we're here to tell you about the male reproductive system.
It has been here since the dawn of man and is recorded in religious texts such as the story of Adam and Eve. In this story, Adam is the first man on earth along with his male reproductive system.
Although the system has been around since humans have existed, the talk of penises is seen as a taboo subject. This results in a lack of knowledge about the system. How much do you really know about it? And do you know how to keep the system safe out of harm's way before medical problems occur?
But before we get started, let's talk about what this system does to your body.
Hi, I'm Elissa.
And I'm Lauren.
And we're going to talk about the vast difference between the female reproductive system and the male reproductive system.
The two major functions of the male reproductive system are to protect and secrete sperm as well as produce male hormones.
Each part of the system plays a very important role in order to meet these goals.
The major organ of the male reproductive system is the testes. They are housed in the scrotum and secrete sperm as well as testosterone.
The new sperm then moves to the epididymis, where they receive their tails and ability to swim.
Just like these tadpoles. Then the sperm moves through the vas deferens and seminal vesicle to reach the ejaculatory ducts.
In the ejaculatory duct, sperm joins with fluid secreted by the prostate gland.
Then sperm moves to the urethra where it picks up Cowper's gland fluid and exits the penis.
For all of this to go down in the system, we must keep it healthy. And how do you do that?
Hi, I'm Dom.
And I'm Alexis.
Take care of your junk. Make sure to go to the doctor for regular checkups to make sure all is well down there.
If you suspect something is wrong, don't hesitate. Pick up the phone to call your doctor to schedule an appointment today.
Also, don't forget to get checked for STDs regularly.
There are also other disorders and cancers that you should be aware of, but here are a few we're going to tell you about.
Testicular torsion is one of the many painful disorders of the male reproductive system. It can occur at any age, but it mainly occurs between 18 and 24. Testicular torsion occurs when the testes move more freely in the scrotum, causing the spermatic cord to twist, just like this picture. When that happens, the blood flow gets cut off and prevents the sperm from getting nutrients in order to survive.
Another disorder that males have to be aware of is Klinefelter syndrome, or I'll refer to as KS. KS is a genetic disorder in which males are born with an XXY chromosome instead of the XY chromosome. This causes males to have low testosterone levels, become more feminine, can develop breasts, and go through late or incomplete puberty. In some cases, the penis won't grow to full size. Low testosterone levels cause males to become infertile and make it hard, if not impossible, for males to have offspring. 1 in 500 to 1,000 males are born with KS. Unfortunately, there is no cure, but there are treatments to lessen the signs and symptoms, such as breast tissue removal, testosterone replacement therapy, and fertility treatments.
Balanitis is a swelling of the forehead of the penis due to chronic skin conditions, improper hygiene, and infections. Some laxatives, sleeping pills, and antibiotics can cause balanitis as a side effect. It occurs in 1 to 20 males, and common symptoms include tightening of the foreskin, discharge, and itchy genitals. Balanitis can be diagnosed by physical examination, and if the cause of your balanitis is a chronic skin condition, your doctor may perform a biopsy. To avoid developing balanitis, avoid using perfumed soaps, lotions, and powders.
We've all heard of cancer, but what exactly is it? Well, cancer is caused by a mutation which causes cells to overgrow. The cancer cells divide uncontrollably and destroy cancer cell tissue. The most common male cancers thrive in the penis, testicles, and prostate.
Prostate cancer is the most common male-specific form of cancer. The symptoms include frequent urination, loss of bladder control, body pain, blood in the urine, a weak urine flow, erectile dysfunction, and decreased semen upon ejaculation. The main tests include a digital rectal exam, a prostate-specific antigen blood test. Luckily, this form of cancer develops very slowly, so the death rate is very low.
Penile cancer is not a very common type of disorder, but it can occur due to having multiple sex partners. It is also genetic, so if a family member of yours has had penile cancer, get tested to see if you carry the gene. Some symptoms include blisters, bleeding, redness, irritation, and lumps on the penis.
Testicular cancer is also fairly rare, as there are about 20,000 cases per year. Testicular cancer has been linked to a multitude of factors, many of which are uncontrollable. Like penile and prostate cancer, genetics play a vital role in determining whether or not someone will have testicular cancer. If a male has undescended testicles, which were corrected by surgery, he is 3 times as likely to develop testicular cancer.
The male reproductive system has been here since the beginning of time, and along with the female reproductive system, it has continued the human race. Because it's composed of many complex structures, many things can go wrong. But because we brought light to these subjects, we can now study it and see how we can improve it. Thanks for watching, hope you learned something new.